Today, we're delving into a widely discussed topic, the potential health implications of consuming ginger. While ginger is lauded for its numerous health benefits, there are circumstances where its consumption might not be suitable. In this video, we'll explore the health conditions and situations where caution or avoidance of ginger might be recommended. Ginger, derived from the Zingiber officinale plant, has been valued for centuries due to its medicinal properties. This root boasts potent anti-inflammatory and antioxidant compounds, potentially aiding in relieving nausea, reducing muscle soreness, combating oxidative stress, and supporting digestive health. In addition, some studies even suggest that ginger may help alleviate symptoms of conditions like osteoarthritis and menstrual discomfort. Its versatility in culinary and holistic practices has made it a popular ingredient worldwide. Now, it's important to understand these different factors about ginger and how they play a role in your overall health. So with that said, let's dive right in and discuss the 9 occasions when you should avoid ginger. Number 1 on our list is bleeding disorders. Bleeding disorders encompass various conditions that hinder the body's ability to form blood clots or control bleeding. For individuals with bleeding disorders like hemophilia or von Willebrand disease, even a minor injury or internal bleeding can result in prolonged or excessive bleeding. Ginger is often considered to possess natural blood-thinning properties due to its active compounds, such as gingerol and zingerone. These compounds might interfere with the body's blood clotting process by inhibiting platelet aggregation or clot formation. For someone with a bleeding disorder, the consumption of ginger could potentially exacerbate the existing condition, leading to increased bleeding episodes or difficulty in clotting. This heightened risk of bleeding is particularly concerning for individuals already on medications that affect blood clotting, such as anticoagulants or antiplatelet drugs. Individuals with bleeding disorders must engage in an open discussion with their healthcare providers before considering ginger as part of their dietary habits. Have diabetes. Several studies suggest that ginger might possess anti-diabetic properties. Compounds like gingerol and other bioactive components in the ginger root have been investigated for their potential to enhance insulin sensitivity, reduce insulin resistance, and lower blood sugar levels. Therefore, for individuals with diabetes, especially those on medication or insulin therapy to manage their blood sugar levels, caution is necessary when considering ginger intake. Ginger's potential to lower blood sugar levels could lead to hyperglycemia, abnormally low blood sugar levels, when combined with diabetic medications. This interaction might necessitate adjustments in medication dosages or careful monitoring of blood sugar levels. Healthcare professionals play a crucial role in advising diabetic individuals on the incorporation of ginger into their diet. Up next is number 3. Gallbladder issues, particularly the formation of gallstones, involve the accumulation of hardened deposits in the gallbladder. Ginger's effect on the gallbladder has been a topic of interest due to its potential to stimulate gallbladder contractions. Some studies suggest that ginger might prompt the gallbladder to contract, which could theoretically worsen symptoms or lead to discomfort in individuals with existing gallbladder problems, particularly those with gallstones. For those with a history of gallbladder problems or diagnosed gallstones, consulting a healthcare professional or a gastroenterologist before incorporating ginger into their diet is advisable. These specialists can provide tailored advice based on individual health status, symptoms, and the potential risks associated with ginger consumption concerning gallbladder health. Understanding the individual's specific situation and considering any possible risks or discomfort is crucial before making decisions regarding ginger intake for individuals with gallbladder issues. Next is number 4, heart condition. When considering the impact of ginger on heart conditions, particularly for individuals with existing cardiovascular issues, caution is advised due to its potential interactions with certain medications and effects on heart health parameters. Ginger contains compounds like gingerols and shogaols that possess anti-inflammatory and antioxidant properties, which are generally beneficial for cardiovascular health. Nevertheless, individuals with heart conditions, especially those taking medications such as blood pressure regulators or anticoagulants, should approach ginger consumption cautiously. Ginger's potential to interact with these medications might lead to unintended effects on heart health. For instance, ginger's blood-thinning properties could add to the effects of anticoagulant medications, possibly increasing the risk of bleeding, while its impact on blood pressure could potentially affect the efficacy of blood pressure medications. Up next is number 5, medication interactions. Ginger's potential interactions with various medications raise concerns about its safe use, particularly when combined with specific drugs. Ginger contains bioactive compounds that can interfere with the body's absorption, metabolism, or effects of certain medications. For instance, ginger might augment the effects of anticoagulant medications like warfarin or aspirin, increasing the risk of bleeding due to its natural blood-thinning properties. Similarly, when combined with blood pressure medications, ginger's hypertensive effects might lead to excessively low blood pressure levels, causing dizziness or fainting. Given the potential for these interactions, it's crucial for individuals taking medications regularly to discuss ginger consumption with their healthcare provider or pharmacist. Number 6, being underweight. For individuals who are underweight or struggle to gain weight, ginger's potential to suppress appetite might pose challenges in achieving weight gain goals. Some studies suggest that ginger may have an appetite-suppressing effect and could reduce overall food intake. While this property can be beneficial for those aiming to manage weight, it may hinder individuals attempting to increase their calorie intake for weight gain. However, it's important to note that the extent of ginger's impact on appetite may vary among individuals, and its effects on weight management might not be solely attributed to ginger intake. Consulting a dietitian or healthcare professional can provide personalized advice on incorporating ginger into the diet while ensuring adequate calorie intake to support healthy weight gain strategy. Next is number 7, pregnancy. When considering ginger consumption during pregnancy, it's essential to weigh potential benefits against possible risks. Traditionally, ginger has been used to alleviate pregnancy-related nausea and vomiting. Some studies suggest that ginger might be effective in reducing these symptoms, offering a natural remedy for pregnant individuals experiencing morning sickness. However, conflicting evidence exists regarding its safety during pregnancy, particularly in high doses. High amounts of ginger could potentially lead to adverse effects such as heartburn or gastrointestinal discomfort. Due to the varying responses and potential risks, pregnant individuals must consult their healthcare provider before using ginger, especially in concentrated forms like supplements or extracts. Healthcare professionals can offer personalized guidance based on the individual's health status, any underlying conditions, and the potential risks associated with ginger intake during pregnancy, ensuring informed decisions and minimizing potential risks to both the mother and the developing fetus. 8th on our list is low blood pressure. Now, for individuals with pre-existing low blood pressure, hypertension, ginger consumption should be approached cautiously due to its potential hypertensive effects. Ginger contains compounds that might naturally lower blood pressure by relaxing blood vessels and dilating arteries, which can lead to a further decrease in blood pressure levels. While this effect may be beneficial for individuals with hypertension, high blood pressure, those with already low blood pressure might experience symptoms like dizziness, lightheadedness, or fainting. Individuals with hypertension must monitor their blood pressure levels and consult healthcare professionals before incorporating ginger into their diet. Next up is number 9, surgery. It's our last on the list, but certainly not the least, for individuals scheduled for surgery, particularly those considering ginger consumption. It's essential to be aware of its potential effects on blood clotting. Ginger contains compounds that possess natural blood-thinning properties, which could lead to increased bleeding during or after surgery. To minimize the risk of excessive bleeding and complications during the surgical procedure, healthcare providers often advise individuals to cease ginger consumption several weeks before the scheduled surgery. This precautionary measure aims to reduce the likelihood of ginger's blood-thinning effects, interfering with the body's natural clotting mechanisms. In conclusion, while ginger is celebrated for its health benefits, its consumption might not be suitable for everyone, especially those with specific health conditions or circumstances. Always consult a healthcare professional or a registered dietitian before incorporating ginger into your diet, particularly if you have any underlying health issues or are taking medications. Thank you for watching. Don't forget to like and subscribe for more fact-based health information. Remember, your health is a priority. See you in the next video.